Hey guys, my name is Tiffany and welcome back to episode 2 of Tiny Talks with Tiff, where I answer some of your common questions that's asked in the NICU.
'Cause anywhere with you feels right. Anywhere with you feels like Paris in the rain. Paris in the rain. When I'm with you, when I'm with you, Paris in the rain. Paris in the rain.
So this series is really more for the NICU parents out there who have some of these questions, but also as a new grad, how to address some of these questions that these parents ask you. Because for me, as a new grad, there was a lot of questions that I would get asked, but I honestly wouldn't know the answer to them because I didn't work in the NICU long enough. I didn't really know an expected time frame of things, how to really answer some of these questions because I've never really seen them before. So hopefully this series is helpful to you. So I've already done the first episode of the series talking about how to get parents involved in the NICU, especially when they're too scared to touch anything. And then in this video, we're going to be talking about when do we feed preemie babies. So I get asked this question so often, you guys, and parents are always wondering, when do we start feeding my preemie baby? And so of course, I always start off with telling them that every baby is so different and it really just depends on the baby. We have a lot of babies that start showing cues early on, and then we have some babies that are really, really sleepy and not really interested until later on. So it really just depends. But the average timeline of when we typically start feeding patients is around 32 to 34 weeks. So 32 is like the early stages of just showing a little bit of cues where babies will start sucking, usually a lot of times because the patient is not eating by mouth during this time. We have an NG or an OG, which is basically a tube that goes down into the stomach to feed the patient. And so we do have some babies though where they actually start sucking on the tube. If they have one in their mouth, they'll actually start sucking on it and showing a little bit of signs of wanting to eat. And so around 32 weeks, they may start showing those types of cues. And so we could try giving them a pacifier and using that as kind of like an introduction to sucking. And then around 33 weeks, we kind of see where they are currently at. If they're still too sleepy, then that's totally fine because they are preemies. And so it is okay for them to not really be interested in eating at this point. But we do have some babies at around 33 weeks starting showing some signs and cues. So what we may do is introduce them to a pacifier and maybe put like a little drop of milk on there and see how well they do with the sucking. A lot of times we have some babies that are very vigorous and they keep sucking on it. And a lot of times we have babies where they suck on the pacifier maybe 1 or 2 times and they get super sleepy and they fall asleep and they're just like totally done with it. So every baby is so different. Around 33 weeks, they may start showing a little bit more cues. And then 34 weeks, we can start initiating some more. So we'll do a pacifier, maybe we'll do 1 or 2 drops with a pacifier and see how they do. And if they do well, then maybe sometimes occupational therapy or speech therapists will come in and they will bring a little, like, you know, a nipple where we can actually insert feeds into it and we can watch the baby suck on it. So it's just any typical bottle nipple that we use. And then we kind of just watch and see how well the baby is able to suck and swallow. Of course, we may do some pacing with them. So we'll just start them off very, very slowly with 1 or 2 drops, have them suck on it, see how they do, and kind of go from there. And then around 35, 36 weeks is kind of like the real initiation of bottle feeding. So at this point, usually what we do is we do some sideline feeds. So definitely make sure to check out the video that I'm going to leave up in the cards above on how to feed a preemie patient, because preemies aren't really developed on their skill levels yet. So we have to teach them how to suck, swallow, and breathe at the same time. And it can be a learning curve for not only the baby and learning how to do that, but for also the person feeding them. So whether it be the parents or the nurse that is feeding the baby, there is a lot of coordination that you need to do and doing pacing with these babies, because we have some babies that want to eat and they don't want to breathe at the same time, and so they will start shutting down, and then we kind of have to wake them up and stop them from eating and then kind of stimulate them to get them to come back up and breathe. So definitely check out that video. I won't go into too much detail about that, but basically, yeah, around 35 weeks is kind of like the happiest medium. 36 weeks is when we really start initiating bottles, and we'll do more than that. So instead of a few drops, maybe we'll do about 5 mLs through the bottle, 5 to 10 mLs, and we kind of just start from there and see how they do. Of course, we're doing a lot of pacing with them, making sure they're coordinating well, they're breathing as they're doing it. We also watch them, of course, but as they monitor, we can look at their respiratory rates and their oxygen saturation levels and making sure they're not breathing too fast when they're eating. Because if they're breathing too fast, it can be difficult for them to really learn how to coordinate feeds and breathe at the same time. And we don't want them to work too hard to breathe, because the number one and most important thing for babies is breathing. So second to that is feeds, and we won't really prioritize the feeds because it's important for us that the babies breathe first. So yeah, if they're breathing too fast and they're working a little too hard, so we may stop feeds. We may just give them a break, or we just give them a little at a time, and then maybe in the next feed we can try again. So that's something that we really look for. And of course, the oxygen saturations. If your patient isn't saturating well, which is basically their blood isn't oxygenating, sometimes their oxygen saturations can drop when they're eating. And that basically means that they're not breathing well. We may have to start the feeds again, really pace them, giving them a chance to come up on their own, or sometimes we stop the feeds completely and we'll try again for the next feed. So yeah, around 35, 36 weeks is when we really start initiating bottle feeds. But like I said, some babies can progress faster than that, a lot slower than that. But around 36 weeks, we really want to start initiating feeds at that point. And then anywhere between 37, 38 weeks is when they start getting pretty good at taking a little bit more by the bottle. So they'll maybe start taking like 15 mLs, 20 mLs by the bottle, and they're doing a little bit better with coordination. And around 38 weeks to full term is when they really develop their skills a lot better. A lot of them can really pace themselves. They'll do like maybe 1 to 3 sucks, and then they stop themselves to breathe. And so we kind of really watch that to see if they learn how to do it on their own. And if not, we still of course try to pace them and things like that. But around this point, usually they are able to coordinate themselves a little bit better and able to take a lot larger of a volume. And so at this point, maybe they may take anywhere between 30 to 60 plus mLs of feeds, which is about 30 mLs is about an ounce, and then 60 mLs is another ounce, so 2 ounces, taking it by mouth and doing really well with that. So that's kind of the general idea, but like I said, this is not the same timeline for every baby, so please, NICU parents out there, don't compare this timeline to your baby, because your baby may progress faster, a little bit slower than some, just depending on what your baby's in for. And as NICU nurses, it's really important for you to really teach the parents how to do pacing feeds, and really how to feed the baby in a safe manner. So if they are desatting, things like that, you really want to show parents how to stop the feeds, sit them upright, really stimulate them to come up, or maybe burp them, and so they can learn how to stop themselves and breathe, and really try to teach parents that coordination. It's super important, so that way they can safely feed their babies, of course in the hospital and at home as well. So yeah, hopefully this video could really answer your question on when is an expected timeline of when we start feeding patients. I get asked this quite often in preemies, and so hopefully this video is helpful, and I will see you guys in the next one. Bye.
'Cause anywhere with you feels right. Anywhere with you feels like Paris in the rain. Paris in the rain.